Welcome back in our discovery of articulations, and in this video we are going to learn all about synovial joints. So here's the thing about synovial joint. They're the joint type that has a cavity in it. In other words, the bones with their articulating cartilages are not going to be close to each other. They're not going to have a fibrous connective tissue. They're not going to have a piece of cartilage there, but what they are going to have there is a fluid-filled cavity there. Now, in addition to this fluid-filled cavity, there are a multitude of structures that are required, and there are some options. So I need you to think of this and keep them straight. For instance, in a car, it's required that you have a gas tank. It's required you have a steering wheel. However, it is an option to have a sunroof, and it is an option to have air conditioning. So at the top of the slides, I've clearly written which ones are required and which ones are options. And so we're going to learn about the structure of a synovial joint first, and then we will come back and learn about the 6 types of synovial joints. And here's the one gift. Because all of these have this fluid-filled space, which you can see there on the left, what that does is like putting a little water balloon between them, and so it makes all of them freely movable. So all 6 subtypes are going to be diarthrotic joints. So let's get started. So what is required? Well, the first thing that's required for a synovial joint is required for every joint, and that is this blue area here of hyaline cartilage, which we call articular cartilage. So you can say either hyaline cartilage at the articulation or articular cartilage. Okay. And these cartilages now are going to be separated by a narrow cavity called the articular cavity or the synovial cavity. Okay. So synovial cavity is the correct name for it. And the synovial cavity is surrounded by something called an articular capsule. Okay. And the fact that it has this capsule is going to allow the fluid to stay inside the cavity. Now the capsule is made out of 2 layers. So looking at this picture of a synovial joint, we already have this blue part being the cartilage, the articular cartilage. So that's not part of the articular capsule. But if we look over here at the side, I think you can see connecting blue to blue on different bones. We have this green thing which connects both of them. And then surrounding the green, we have this tan, which is connecting the 2 bones. So those are the 2 layers of the articular cartilage. The outermost layer, that tan part, is called the fibrous capsule. And if you look at the fibrous capsule on both sides, what you will notice is we have periosteum of bone, which becomes fibrous capsule, which then becomes periosteum of the adjacent bone. And so just like periosteum was dense, irregular connective tissue, so is the fibrous capsule going to be dense, irregular connective tissue. And then inside the fibrous capsule, this green area is called the synovial membrane. And so what this has is this has an epithelium. This is a space. And so all surfaces, a space has a surface. All surfaces in your body have epithelium. So it has this epithelium underneath which there are a lot of little blood vessels, and so it's going to be secreting fluid. There's also going to be macrophages which are going to be leaving, and they can remove debris. Now I want to point out that the synovial membrane completely surrounds the cavity space except where there is hyaline cartilage. The articular cartilage is not covered by the synovial membrane, because what we don't want is membrane rubbing against membrane. All right, the next required element is we must have synovial fluid inside the synovial cavity. And as I said, this is secreted by the synovial membrane. It's very thin, very slippery, kind of think of the slipperiness of an egg white, but it's not as thick as an egg white. It's more watery than an egg white, okay? And so it can be absorbed by the cartilage, and when cartilages are squishing together, it can ooze out of the cartilage. And so it contains stuff like hyaluronic acid, a bunch of interstitial fluid, MP, or macrophages. Now, I don't know, but if you have a grandparent who has arthritis, but a lot of people do, and what they realize is you can't call them at 8 o'clock in the morning or 9 o'clock and say, let's go to the mall, because they'll say, wait a minute, my joints are stiff, let me get a chance to get them working. Because what happens is at night when you're sleeping, this fluid thickens up a bit. It doesn't have as much water in them. And once you start using your joints more, then the liquid becomes less thick. And so it's easier for your joints to move. We can put a needle into the joint to withdraw fluid, and normally it's absolutely clear. You could read a newspaper through it. And the various types of arthritis, it is going to become more opaque because you're going to start having inflammatory cells. If it is due to an infection, you're going to have a lot of white blood cells. And obviously, if you have trauma, you would have red blood cells in there. And so the example of a septic arthritis that I put is somebody who has gonorrhea. Did you know gonorrhea can give you an arthritis? Okay, so it's not just a disease that affects your reproductive tract. All right. Another required element is a reinforcing ligament. So we are going to have a ligament which is going to connect the two bones, and by doing that, this is dense, regular connective tissue where all the fibers are aligned in the direction of the joint, so it's going to add stability. And it's going to be containing Pacinian corpuscles, which will help you with your, it's a sensory receptor to help you with your sensory input. Now, these reinforcing ligaments can be outside the articular capsule, in which case we call them extracapsular ligaments, or they can be inside the capsule, as shown here between the head of the femur and the acetabulum. This is not the only joint that has intercapsular ligaments. For instance, if we look at the knee, as you have learned with the lab material, has extracapsular ligaments, the collateral ligaments, as well as intracapsular ligaments, the cruciate ligaments. So those are required for all synovial joints, either intracapsular or extracapsular reinforcing ligaments. So that's it for the things I want you to be able to tell me if I ask you what is required. Now, of course, all synovial joints are going to have nerves and blood vessels that let you know where you are into space. And because we have that synovial membrane, we have a lot of blood vessels so we can get the synovial fluid. But please do not list these as required elements if I ask you to tell me what is required. So let's talk about some options. The first option is called an articular disc. And what an articular disc is an extra piece of fibrocartilage, which has various shapes depending what joint you are talking about that. And what they do is they make bones fit together. So if you look at this drawing, you should be able to tell that this is actually a knee joint, which is one example of a joint that has an articular joint, a disc. And you know that because there's the patella there. So this is the femur and this is the tibia. And in the knee joint, which is technically a fibulotibial joint, the articular discs are much wider laterally and narrower medial. They are C-shaped, very high on the side, very narrow medial, to try to prevent the condyles of the femur from sliding off the flat tibial condyles. Okay. And then if you go on in physical therapy, you will learn about how these allow different movements in different parts of the joint, but that is not anything we're going to learn about in this introductory anatomy class. So here are the examples of joints that have articular discs. Tibiofemoral, that's your knee joint. Temporomandibular, your TMJ, where your mandible attaches to your temporal bone. Between your sternum and your clavicle, right here. Between the acromion of your scapula and the clavicle out here. And between the radius and the ulna and the proximal part, because distally, remember, that is a fibrous joint, but so it's the proximal part that is a synovial joint. All right, another optional item is a fat pad, and basically these are helping to cushion. We have lots of them in our hips and our knees. If you look, we can have fat between the bones and ligaments, or between the ligaments and the skin. The next option is something called a bursa. And a bursa is a fibrous sac exactly like a synovial cavity. And in fact, it came from that, and then they pinched off from there. And it contains synovial fluid. And so this is like having extra little tiny water balloons at points where ligaments, muscles, skin, tendons, or bones would rub together. And some joints will have half a dozen bursas, whereas other will only have 1 or 2. So this is only showing 4 of the bursas that we have at the knee, but there are more than that. So this one is showing a bursa between the patellar ligament and the tibia, so it doesn't rub before it articulates with the tibial tuberosity. And then we have another bursa that is between the ligament and the skin. There's a lot of bursas in your elbow, so if you have tennis elbow, that tends to be a bursitis. If you've ever heard of bursitis, that is inflammation of a bursa. Another optional item is very much related to a bursa. So take that water balloon and make it long like a hot dog bun, okay? And then, so this green thing is the structure. It's called a tendon sheath because what is lying in that hot dog bun is a tendon. So this is reducing fraction of a tendon of a muscle with the bone that it is sitting right next to. So a classic example where you have tendon sheaths, we have a lot of them here in the digits in our hand. We'll see that when you learn about your muscles in lab. And then, but if you go back and you remember the intertubercular groove in your humerus anteriorly, that is where the long tendon of your biceps brachii muscle goes. So every time you are flexing and extending your humerus, that tendon is going up and down in that groove, in that sulcus. And so it's encased in this tendon sheath so it doesn't shred on the muscle. So take a minute, freeze the screen, and think about all those required and optional elements I've just talked about in a synovial joint, and try to figure out which synovial joint this is and what those 3 things are. So I'm going to give you some time, figure that out, and then come back when you're ready to see the answers. Okay, so hopefully you have written down. If you haven't written down your answers, I'm going to ask you to pause it again and write it down as if this was a quiz. All right, so now here are the answers. This uppermost one, the pointer is in the space, so you could call it a synovial cavity, and it's containing synovial fluid. The second one, yes, so in case you didn't figure out, this was your shoulder joint. There's your clavicle. That is part of your scapula. This is your glenoid fossa, and this is the head of the humerus. So what is this white structure on the head of the humerus? That's right, it's your articular cartilage. And so if you know that's articular cartilage, then you should have been able to figure out this is articular cartilage. And so what is connecting the two? Pause it and figure it out. That's right, that's the articular capsule. Okay, so hopefully you understand that a little bit better. So now let's talk about the 6 types of synovial joints. And there's all 6 of the names, but I'm going to go through them one by one so you can understand the difference in structure. And I also will give you examples of joints that have that structure. So the first is called a planar joint. Okay. And these are bones that have a surface that's almost flat, and there's 2 adjacent bones with surfaces that are almost flat, and they are just going to slide across each other. They're sometimes called gliding joints. So classic examples of these are going to be joints between carpal bones or between most of our tarsal bones. Not all of the tarsal bones, but most of the tarsal bones will have planar joints. Okay. The second is called a hinge joint, and this is a joint type that I'm sure you learned about in grade school. You learned about hinge joints and ball and socket joints in some grade school science class. And what happens in a hinge is kind of like a door hinge or the bench of a piano seat, where you have a trough and something fits in it. Okay, so as in seeing the picture on the bottom right. So the classic example of that is the trochlea of the humerus fits into the trochlear notch of the ulna. Okay. However, we also have a hinge joint in our knee, with one caveat. I don't have knee written down here because even though we are taught that the knee is a hinge joint, because it has those cartilages, it has some other type of movements going on because of those menisci. Okay. The third type is a pivot joint. Basically, we have a bone that either forms a circle or a bone that has a ligament attached to it, and another bone will fit into that, so that we have a bone articulating with a ring that is partly bone or completely bone. And so the 2 classic examples of this are the head of the radius with the proximal ulna. Actually, it's not the top of the radius, it's the proximal part of the radius. It's on the side of the head of the radius. Okay. And then the other one is when the dens of the axis goes into the vertebral foramen of the atlas. So those are the examples of a pivot joint. The next type is called a condylar joint, which has an oval depression and it has an oval surface that fits into it. So this allows movement like not only anterior and posterior, but lateral and medial. So it allows movement in a couple of different directions. But because it is oval, not round, it doesn't allow rotational movement. Okay, so you get movement in like an X and a Y. And so examples of these are your knuckles here between your metacarpal and your phalanges, also between the radius and the carpal bone that's right there, and also between the atlas and the occipital condyles. That lets you nod your head yes. So sometimes these are called knuckle joints or ellipsoid joints because they're oval in shape, but we're just going to go with condylar joints. Related to condylar, but slightly more complicated, is a saddle joint. And so this is kind of like putting 2 condylar joints, one oriented this way and the other one oriented this way, and putting them next to each other. Because each surface both has a depression and a hill. So each of them has both the convex and the convex area. So it has a little bit more movement than the condylar joint, and there's only one place. Okay, and now this is where the carpal bones meet metacarpal number 1. So it's down here, it's not up here. This is one of your condylar joints because it's metacarpal phalangeal. This is the saddle joint. And then the last type is a ball and socket, which is an oval depression with a head. And so that allows movement in a lot of directions. So we have it in the shoulder where we have the glenoid cavity of the scapula with the head of the humerus, and then in the hip where we have the acetabulum of the coxal bone with the head of the femur. And so those are the 6 types of synovial, 6 subtypes of the synovial joint. So we had 6 types of joints, and we're going to have 3 types of angular movement. And for the angular movement, so go back and look at them. If it has no angles, if it's just sliding, that's called non-axial. If it can move in one direction only, like your elbow, that's going to be called a uniaxial. If it can move in 2 directions, that would be biaxial. And if it can move in multiple directions, that would be called multi-axial. Okay. So here's an example of a skeleton. What I suggest you do is work through this, write down what each articulation is, and don't just write knee, don't just write shoulder, write exactly what joint, what bone and bony landmark is articulating with which other bone and bony landmark. Because we have more than one articulation going up here in the shoulder area. We have more than one articulation going on in the knee area. We've only talked about the most common one. So go through, write the type, write the subtype, and write how much axiality you think each of these joints have, making sure you're writing bones and bony landmarks. When you're done with that, and you're done with your studying of these, here is a table I created, parts of it. And parts of it were created by a student I had years ago, and then I added to it. And I know that there are examples of it filled out online, and I know that a lot of those examples have errors in it. So I don't want you to look there. What I want you to do is, if you've studied, you should be able to figure this out. What are the 3 structural classification? This one has 2 subtypes, this one has 3 subtypes, this one has 6. For each of those subtypes, then give the functional classification. And for each functional classification, can you name one joint, and not with the word knee, with the word specifically? Name one bone and name the bony landmark that it articulates with a bone and a bony landmark on the other side. And then for the synovial joints, which are these down here with the 6 types, also write in how many degrees of freedom. What is the axiality? Is it monaxial, uniaxial, biaxial, or multi-axial? And if you can fill this out, then you know you'll be ready for the test on this. And if you can't fill this out, that means you've got some more studying to do. What you should not do is look at this slide and then try to use your notes and fill it out and memorize it, okay? Learn it first and then see if you can fill it out. And with that, we are done with this section on synovial joints, and I will see you again for the 3rd and final video on articulation.